A lot of times people see rotator cuff injuries on ESPN and from high-level athletes, high-throwing athletes, high-level baseball players, and certainly that's a possibility and certainly a case. But lots of people get rotator cuff injuries. There are four major rotator cuff tendons of the shoulder, two on top, one in the front and one in the back. And those tendons are prone to injury from trauma, from repetitive use, and from everyday activity. The number one way I see usually rotator cuff tears are in people in their 40s to 70s who fall, slip and fall on the ice, land on their shoulder, fall off a ladder, have some trauma where they land on their arm, and they feel a pop or a snap and have trouble lifting their arm. And that can become a devastating problem if it's missed because the tendon can get worse and retract and then not be fixable. So we try to find those injuries early and treat them appropriately. But a lot of people think it's just the athletes, the high-end athletes that get it, but in reality, it's one of the more common things we do for everyday people. So the rotator cuff, again, is four tendons, which are basically muscles become tendons, which attach to bone. We all get wear and tear over our lifetime, and so we talk about attritional tears. Attritional are basically wear and tear that over, I call it death by 1,000 paper cuts. You have tiny little injuries in your shoulder, and the blood supply to that tendon is a little bit limited and doesn't heal as well, and you get these little tears that unravel over time. And you can become 65, 75 and start to get more and more shoulder pain and then be diagnosed with a tear. And patients say to me, well, how does that happen? And the short answer is it's happened really over the course of a lifetime of cumulative trauma. But having said that, most of the other kinds of the trauma, which is the ones we see more often, the way to avoid it, obviously being in shape is and not falling is the best way to avoid it. But there's not, once you've fallen or injured it, it's hard to avoid trauma. No one wants to fall on purpose. There are things like smoking, which has a negative impact on our lungs, and cancer. Everyone knows about that. But smoking actually has a negative impact on tendons. And so smokers have a harder time healing tendon injuries and can have poor nutrition to their tendons, which can predispose them to that. So I tell all my patients, if you smoke, quit smoking, not only for your lungs and for cancer prevention, but for your orthopedic health. There's two kinds of people who underestimate rotator cuff repair. One are doctors and two are patients, meaning we all do. Everyone, I think, tends to underestimate rotator cuff repair. That's because the shoulder is a soft tissue joint, meaning the ball and socket are very shallow. So unlike the hip, which has a deep ball and socket, it's sort of a shallow ball and socket and very dependent on the soft tissue. And so when you injure the soft tissue, it takes a longer time to heal. Oftentimes, we fix this arthroscopically. Probably 90% of the time we fix rotator cuff injuries arthroscopically, meaning through poke holes. And patients wind up in a sling for 6 weeks. They have to do physical therapy, and oftentimes they have to do passive movement, which means the therapist has to raise their arm for them for the first 6 weeks and then afterwards start active movement. But I tell my patients it takes a good 6 or 7 months, 6 to 8 months for them to get better. I had one patient come back and tell me I got better 10% every month. And that really stuck with me, meaning that the last couple months are easier than the first couple, but it can take a long time to get well from that. It's harder, obviously, if you're a carpenter, if you're a brick mason, if you're a Major League Baseball player to recover from that. If you work at a desk or you're a lawyer or an accountant, it becomes an easier thing to do because there's less stress to the shoulder. But either way, there's no one who says, no patient says to me, boy, that was a quick recovery with rotator cuff repair. It always takes a long time.